So first I would like to ask your permission to use a follow-up testimonial after your procedure.
Yeah.
So tell me, what were your symptoms before our surgery in 2016? What were your symptoms?
My left leg, when I woke up in the morning, my left leg hurt
How bad was the pain
for
then?
about an hour, hour and a half.
How bad was the pain then?
I-
How bad?
How
1 to
bad?
10 was the pain then?
Very.
You know,
Very
7,
severe.
8, something like that. Yeah.
Very.
Yeah.
How long did you have that pain? How long before the surgery in 2016?
Oh, I think
How many years?
a half a dozen years.
Half
Yeah.
a dozen years. Okay,
Yeah,
that's a long
yeah.
time.
Yeah.
Now, what we notice, you have a scoliosis. You have a curve angle of 17 degree.
Yeah.
That your spine was twisting and bending the wrong way and pushing on the nerves. That's why you had the problem. And after we weren't able to make you comfortable, we did the surgery in 2016. Now tell me, after the surgery, when did the leg pain go away?
Right away.
Right away.
It was
So you
gone.
woke up and the pain was gone?
Yeah.
And
Yeah.
that is, I'm actually turning to your record of the surgery here. And it seems that our surgery was actually only 82 minutes. You stayed in the hospital only 2 nights. And we did the L325 so-called segmental fusion, minimal invasive OLLIF. And so you woke up and the leg pain was gone. How have you been since the surgery, since 2016?
Just normal.
Normal.
Yeah.
Okay. And then, how long after the surgery did you need to get back to your basic daily activities?
Yeah.
How long did it, how many days or weeks did it take you to return to your basic daily activities?
None.
It
So-
was really quick.
Really
None.
quick.
It was like
It was
when I woke up
unbelievable.
after the surgery,
Yeah.
it was gone.
Well-
And I've never had any pain since.
Okay, and you said it was unbelievable. What was unbelievable about it?
Well, when I went to pick him up at the hospital
Mm-hmm.
that morning, he was walking down the hall.
Yeah,
And
okay.
I thought he would be staying for a few days. And
Yeah, yeah.
boom, he said, I'm ready to go home.
Well, the reason you felt so good is because we did the surgery minimal invasive. And we didn't really disturb, fillet your back open, cut lots of muscle or bone. That's why you recovered so much faster. Do you mind me to have a look on your back, on the incision from that surgery?
Oh, sure.
Yeah, if I just may come back here.
Amazing.
And here, it seems that you had a previous surgery before here. So,
Yeah.
but
I had a laminectomy.
laminectomy, that didn't help you. And as a matter of fact, a few years later, the pain was back. But the real surgery that we did for you, do you mind to turn a little? Is actually really hard to see. As a matter of fact, I'm going to just, if you don't mind, draw that where we did the surgery on your back so she can look at that with you later. The area that we did the surgery, these are the incision from the surgery that we did that practically it's almost impossible to see.
Yeah.
So you don't even see the scarring from that surgery. So please have a seat. Now, you waited half a dozen years before you got that surgery and you were in pain.
Yeah.
If you had a similar problem, would you wait that long again or would you want it to be fixed sooner?
I didn't understand the question.
Now, you said you had that problem for half a dozen years,
Oh, yeah.
for 6 years or so,
Yeah.
and you waited a long time to get it fixed. Why did you wait that long?
Well, because I talked to an orthopedic surgeon at Sanford and a
Neurosurgeon?
neurosurgeon at Sanford. Both of them said, we can do it, but you won't like the result.
Oh, okay. Well,
And we'd just as soon not do it, literally.
okay. Well, but we talked and we
So my
discussed.
chiropractor, Chris Singer, recommended I come and see you.
So when we did the surgery, do you like the result of our surgery?
Absolutely, back to normal.
Back to normal. Well, I'm so happy to hear that, and thank you so much for the testimonials. Now, but there are other surgeons are realistic about the way to do that open old-fashioned surgery.
Yes.
It's so damaging, so much more intrusive and invasive that you may not like the result
Right.
because we cause lots of damage on the way of getting
Yeah,
the job
yeah.
done.
My
And-
best friend had that kind.
That
And her
okay?
surgery scar is about that
Mhm.
long, and she had almost died, and it took her a long time to recover.
Unfortunately, your experience, what you just described, is a realistic. Is a truly. That is why we surgeons are so
Careful.
holding back of offering this kind of surgery
Yeah.
to people your age group because those
Yeah.
surgery can be extremely dangerous. But we have a track record. We can do that surgery in a fraction of a time with a few spoonful of blood loss, and people tolerate that much better. So your
Sure.
experience and what you just described is nothing unusual. We get lots of patients that go to other surgeons that are being told, you may die of this surgery. This is a whole day surgery, and we do that in an hour or two and send them home at the next day or two. So your experience is very representative.
I'm very happy that they are honest about that too.
Yeah,
When you
absolutely.
go to them and they say no,
No.
that's what they should say.
Yeah, that's what they should say, but as well they should say that there are some other options.
That's right, they should say
They
that.
should say there are some other option, and in all truth, if you don't walk in your age group, if for whatever reason, that is not a harmless thing. So if you don't walk, it is like a shark that doesn't swim.
That's
A
right,
shark that doesn't swim drowns. A body that doesn't walk shuts down.
yes.
So not walking, in your case, for pain, for whatever reason, is literally very demanding on our body, on our heart, on our lung, and so on and so forth. So
Sure.
we have to keep you going.
Keep going.
Yes, exactly. And sometimes, we have to just balance risk versus benefits. For that reason, it is important in your situation to take your pain away so you can walk. Okay?
Oh, yeah. Yeah.
Exactly. Paul?
He's building another airplane.
Oh, wow. So you are building an airplane. So tell me about
They're
it.
rehabbing or
Yeah,
rehabilitating, whatever you call
you
it.
are practically rebuilding it. Okay.
Yeah.
Tell me,
yeah.
what exactly do you do for that airplane? What airplane is it, and what are you doing?
Oh, it's called a J3 Kitten.
Okay.
It's a single-seat airplane that you can fly without a
License?
aviation medical.
Oh, I see.
Yeah.
Okay.
You should have a license because that'll teach you how to fly.
Yes, that's right.
But I've got I had a heart attack 36 years ago,
Mm-hmm.
and I have just a mild ischemia,
I see.
and the FAA doesn't like that.
But you are having lots of fun to build that airplane, I see.
Oh yeah.
Excellent,
Yeah, no,
excellent.
this is number 4.
Okay, well, I'm happy I could be of help to put you on a path for you to enjoy your life.
Oh, absolutely, yeah.
Thank you.
Yeah, well, thank you so much. I appreciate that.
And